Welcome! Today we're diving into a really fascinating medical case that tackles a tough problem. What do you do when a hip replacement fails, and then the next one fails too? Let's get right into it.
So yeah, this is the big question. We're talking about what's called a re-revision, and it's basically a third attempt to get the same hip right. Imagine being a patient who's already been through 2 massive surgeries, and you're still not fixed. The stakes here are just incredibly high.
All right, so let's meet our patient. He's a 59-year-old man, and for him, this hip problem wasn't a recent thing. No, this was a saga that had been going on for the last 2 decades of his life.
This timeline really maps out a 20-year battle. It all started with a fall from a height that led to an untreated hip dislocation. Fast forward 18 years, and he finally gets his first hip replacement. But it didn't last. Soon after, he needed a second surgery, a revision. And just a year after that, still dealing with pain, he walks into the institute that published this very report.
So by the time he gets to this new team, his situation is, well, it's pretty severe. We're talking about constant pain anytime he puts weight on it, a feeling of instability, like the hip could just give out at any moment. And on top of all that, one leg is 4.5 centimeters shorter than the other. That's nearly 2 inches. Think about the massive impact that has on how you walk, your posture, your whole quality of life. Now, to find the right fix, the surgical team had to basically become detectives. You see, they couldn't just jump in and try a third time without understanding the root cause of the previous failures. This is such a crucial step. You have to know why it failed to make absolutely sure your new solution is going to succeed.
This was the million-dollar question, right? The team dug into all the previous x-rays, all the patient history. Was it some kind of hidden infection? Were the implants loose? Or was it something much more fundamental about the actual mechanics of the replaced hip?
And bingo! They found their answer. The problem wasn't the implant itself, it was its position. It was all anatomical. You see, in a good hip replacement, the new ball sits perfectly in the natural center of the socket. But in this patient's case, the implant was placed way too high. This high hip center threw off the entire biomechanics of the joint, and that was causing the instability and the pain.
And this brings us right back to that number, 4.5 centimeters. This wasn't just some random symptom. It was a direct result of that high hip center. By putting the socket too high, the previous surgeries had actually shortened his leg, which put this incredible strain on all the surrounding muscles and created that constant, unnerving instability.
Okay, so they knew the problem, but to fix it, the team couldn't just swap out the old parts. They had to literally rebuild the patient's anatomy. And with so much bone loss from the other surgeries, they needed a really specialized piece of tech to do it, something called a metal augment.
So what in the world is a metal augment? Well, think of it like a high-tech, medical-grade wedge. It's this piece of porous metal, usually titanium, and it's designed to perfectly fill in the gaps where bone is just gone. And that porous structure is the real magic here. It acts like a scaffold. It provides immediate support for the new hip cup, sure, but it also allows the patient's own bone to grow right into it over time. That creates this super strong biological connection.
So with this tool, the plan became crystal clear. First, you've got to carefully take out all the old, failed hardware. Then you prepare the damaged socket and fit that metal augment right into the defect, essentially rebuilding the roof of the socket. Once that scaffold is in place, then they could secure the new cup in the correct anatomical spot, finally bringing the hip's center of rotation back to where it always should have been.
All of this careful, meticulous planning and this incredible technology led to a truly remarkable outcome. The surgery wasn't just a mechanical success, it was completely life-changing for the patient. It gave him back a level of function he hadn't had in years.
The data here really speaks for itself. The Harris Hip Score is a standard way to measure hip function. It combines things like pain and mobility into one score out of 100. Before this surgery, the patient scored a 37, which points to severe limitations. Just 12 months later, he scored an 82. That is a gigantic leap from severe disability to a really good functional life.
And here it is, the visual proof. This X-ray after the surgery shows the new implant sitting perfectly. You can actually see how the metal augment has filled that defect, letting the new cup sit exactly where it's supposed to. The difference between the before and after is just night and day.
But what does all this really mean for the patient? It means going from constant pain and the fear of your hip giving out to walking freely without any support. That leg length difference? It went from a whopping 4.5 centimeters down to just 1. For the first time in a very, very long time, he could just move with confidence and without pain.
You know, a case like this is about so much more than just one successful surgery. It offers really crucial lessons for any surgeon who has to tackle these incredibly complex revision procedures. It highlights a clear path forward when you're facing what seems like an impossible problem.
The authors of the report really say it best themselves. Success in cases like these isn't just about what you can do in the operating room. It's about that meticulous detective work you do beforehand, using advanced imaging to understand the bone loss, and most importantly, identifying the exact reason the last surgery failed. That, right there, is the key.
So, what are the big takeaways here? Well, first, there is no one-size-fits-all solution for these complex cases. Second, incredible technologies like these metal augments are absolute game changers for severe bone loss. Third, the goal always has to be restoring the patient's natural anatomy. And finally, and maybe most importantly, you have to figure out the why before you can even begin to fix the what.
This case is just a beautiful demonstration of how a combination of deep diagnostic work and advanced tech can solve a problem that was, for this patient, unsolvable for 20 years. It leaves you with a really hopeful question. As our tools and our understanding get better and better, what other challenges that we think of as unfixable today will become the routine successes of tomorrow?
A huge thank you to the authors of this case report for their incredible work, and thank you for watching.